Morning, everyone.
Morning.
Is Brandon in?
I'm here.
All right, cool. Sorry, I'm just switching to my computer. I was having some tech issues myself. Do we have Dan Caprio online at all?
Not yet.
Oh, okay. Give me one more second.
He's the password right up and he.
Okay. Gonna go ahead and call this meeting to order. I think first, there's no changes to the agenda, so we're gonna go ahead and gonna ask for motion to approve the minutes from last month.
I move we accept the minutes as written.
I second.
Any discussion? All those in favor say aye. Aye.
Aye.
Sorry, Elliot, did you vote?
Is Elliot on? I don't,
He's not here.
I think it's just,
Oh, I'm sorry. Who's
so,
who's to the left of Brandon?
Mr. Heffernan.
Mr. Hefty stays here.
Oh, sorry, Jack.
That's the first time I've ever been mistaken for Elliot Simon. I'll take half of his IQ. So
It's a video issue. I'm so sorry. All right, thank you so much. Sorry. So meeting minutes pass. Sorry, it's very early for me right now on the West Coast. Is there anybody for public comment?
No.
All right. Then we're going to go into unfinished business. I think that's you, Dr. Reedy.
You want to start with these or move them for later? It's up to you.
The which?
Would you like to do these now or do them during our reports? Yeah.
If you'd like, we can go through the financial updates so that we can let our post holiday folks head out, and then we can always come back to the unfinished business if you guys would like.
Yeah,
We'll do that. So we'll go ahead, Amber.
All right. So we're going to start off with February. You currently have an unreconciled bank balance of $418,000. Subtract the reserve amount of $425, you come out with non-compliance by about $7,000. February's revenue, we brought in $20,000. Salaries were just under 90, and operating expenses 21, for a deficit of just under 91,000. Year to date, sorry, we've brought in 818,000. That is 17% below budget. Salaries 902,000, which is 3% above budget. And operating expenses of 241,000, which is about 2% above budget. For a current deficit of 325,000. Accounts receivable is down at 100,000 currently, or in February, which all makes up, nothing was over 10% of that receivable. So all of it were smaller amounts. Questions on the February?
Any questions?
Yeah, this is the first month I think I've seen $0 in the receivables for the state. And so it sounds like they're up to date on their payments, but our revenue is down 18% year to date. Are we anticipating that hitting the books? I know there's a ramp up, but I thought it started ramping up in February. Maybe we can just talk a little bit about that.
So we can, and we'll be discussing it more later, but the, so yes, the state has paid pretty much all of, as of the end of February, paid all that we had in for them. And we, every few months, we're putting in some more. The big amounts are paid. One big outstanding, which we'll go into later, is that there's a fair amount of money, maybe about $100,000 related to the QRT grant that has not been billed, and that is after this meeting that becomes like job one is to get that in. So it's money that we've already paid to the staff. There are various reasons why it wasn't, including it wasn't until the end of February that we actually got the final contract and the how to bill it. So we just have to compile the data and send it in. So it's just a little bit of there's a little work doing that, but it's nothing. So that's a big item, and it's that will help with about, as I say, about 100,000. The other, and then we'll talk more about upcoming grants, but right now all of our grants, except one for a relatively small amount of money, are still on track. And Brandon will go over that more. In the past, we had all these grants from preceding years that had not been settled, and that was primarily at the state end, that they hadn't been closed, and that's been cleaned out.
Also, I ran a report today and the AR is about double, meaning your billings are way up this month in April compared to February and March here. So we should see an upswing.
But this deficit is about double what it normally is.
It is. It is. And like Dr. Reedy was saying, we are missing the QRT grant in there. So that should increase about 100,000 is what we were saying.
About 100,000.
About 100,000. So.
And then, as I've talked about before, and I'll show a graph later, is the permit fees for environmental come in about this time. And the April, so April won't show up on either of those reports. April, we've already had like $180,000 come in from those permit fees. It's like inheritance.
So you fully anticipate that curve
I
from
anticipate,
previous years?
so if we look at this as 300,000 in deficit, and then 100,000 with QRT and 200 from the permit fees, which normally doesn't hit till this time of the year, that should be closer.
Land us a lot closer than the other.
But this 100,000 of small things that are less than 10% have been there for quite some time. So when do we address that those have to be written off?
So we can talk about it now.
Yes, so actually running a report, thanks to Cox Holiday, Amber and Charlie specifically for working me through QuickBooks a little bit. And we have an outstanding debt of roughly $72,772.67. That is over 100 days old. These are things ranging from areas of insurance collection. Mostly it seems to be some are in minor stuff, some are bigger amounts, even from the state West Virginia Treasury that we're still owed. However, getting that financial income back in is probably something that we do need to discuss about taking off our books. How things have ran before, how things were done, it makes us look like we have certain money coming in that we will not, and we are trying to improve our policy procedures, our billing, and everything else. As Amber said, we're looking pretty good now with our billing stuff, right? So that amount, unfortunately, is probably non-collected.
Do you have the number over 365?
Over 365, no.
So 72 over
The report does show 360.
That's good enough.
Yeah.
Anything over 360.
That would be the report I gave you this.
Yes, and that's sitting at roughly, just that amount is $50,497.13.
Okay.
Um,
Cause I think anything between the 180 and 360, there's probably some recourse with the insurance policies on those. It's a 360 plus that are likely,
understood,
yeah.
understood.
Is there a way to send those to some collection agency and whatever we get is better than what we have?
There could be, I don't quite understand that. We have to fall back on some expertise, as far as sending medical insurance debt, for a collection. And yes, there could be, but what we would get on is pennies on the dollar, right? They buy it, and we're talking things that are $36.33, $4, $25.
Yeah.
So what collection agencies would offer us would be dollars, on those amounts. And with that, yes, while any money is good money, it's still, it's kind of almost a moral ambiguity in some cases as well. Do we get this small pittance of amount comparatively and then allow these people that probably have financial hardships to now deal with debt collectors?
Yeah, I think the moral question is something we'd have to discuss, but also depending on the contract, if it was billed incorrectly and the insurance company denied it for a technical reason, that patient received an EOB that says zero patient responsibility. And if we were to send them collection agencies and patients were to investigate, they would see, hey, well, I got a bill for my insurance that said I don't owe anything. Now you're saying I owe something. It's almost like we're bypassing the insurance processes and try to kind of work around that. And I think it could come back and bite us for what I think of it would ultimately be not a whole lot of dollars.
Correct. And it may go against our contract with the insurance company, our agreement to participate with them if we're billing for things they denied and we didn't have an advance beneficiary notice. So it's there is a medical billing company we worked with a couple of years ago during when we were able to start billing for the COVID administration. And they helped us in the local, when we reached out to them about a year ago, they had too much work to take on a new client, but we may ask them again about this certainly. And we may have some other people we can talk to. But one way or the other we want to deal with this, if we can get some money, we can certainly use it.
I know so little about this, but if it's incorrectly billed, the customer or the policyholder gets a notice that it would be covered, even though it was billed incorrectly.
I don't think so. Most of the stuff in the page would just say, you know, insurance covered, zero patient responsibility. It wouldn't kind of necessarily say that provider billed incorrectly or something along those lines. At least in my experience.
They would send out a letter called an explanation of benefits. And then when that happens, then it breaks down the billing and what each individual was owed, essentially what is covered by insurance was not. And so in those cases, like Mr. Pope was saying, they would just say that it would be zero for the patient. So the patient has no clue whether or not we billed correctly or incorrectly, what's actually covered by the insurance. That's what the deal. They just.
So if it's something that's covered by insurance and they decide we did not divide it by however they define that, or it wouldn't be covered, that we would suffer the loss. If it's something that wouldn't be covered, let's say they wanted a shot because they're going to Egypt and that shot is not covered under the policy, then we have to collect the money up front or have the patient sign an advance beneficiary notice which says, I understand I will pay the cost if my insurance company denies this, which can be done in certain cases. And then we need to get the money that way. But if we haven't had them do that, whether it's Medicare or Blue Cross or Medicaid, then we can't go and try and get the money out of it. out of the patient. It comes down to each insurance company being a little different, but so it's very important for us to learn all the rules, follow all the rules, and do them in a timely manner because the clock's ticking once that service occurs, and we have to send it in. It may take many, many months until a back and forth settles it, but we start the clock. The clock starts when we see the patient, and then the next clock starts when we send the bill to them, to the insurance company, and then there can be back and forth. But it's we have to do that in a timely manner, and we haven't done the medical billing to what the industry requires.
Are you
Somebody
currently
knows lots
using ABNs now?
So most everything we do would be covered by the insurance. For people we know, like someone that's going to get a typhoid vaccine before going overseas, we check with their insurance company if it's going to be covered, and electronically we can check, and if they will cover it, then we go ahead and administer it and bill the company. If they say no, it's not covered, then we ask for payment up front because we have to buy the vaccine. So that's how we can say with rabies vaccines. It's typically not covered for someone that wants it because they're going to be working with stray cats or something.
Mhm. So the 100 total, you're saying 50,000 is over 360.
Right.
There's another 20,000 between 180 and 360.
Yes, sir.
Like 76,000, I think you said.
It's so it's 72,000 total.
72.
Roughly 22,000 of it is
Okay.
between 180 and 360.
And then 30 between 0 and 180.
To equal this. Oh, yes, I'm sorry, yes. Yeah, well,
Okay.
we have,
Yeah. I won't say there's no recourse for everything over 360. I would definitely do due diligence and call the payers and find out if there's appeal opportunities, if we can resubmit. Sometimes if you submit a claim, they'll kick out the timely filing based on your last submission. It's definitely not foregone conclusion. I think the likelihood of collecting the majority of that would be slim. And then it's the question of whether we want to try to pursue other means and the implications of that and whether we can contractually. But the between the 180 and 360, that's collectible if there's action and follow through, and we just have to continue to hammer at it and can't ever let it slip.
And there is a certain percentage of these that are over $400 or $500. And those I think we need to look at a little differently than the ones that are $40 for
Sure.
COVID vaccine 3 years ago that
Yeah.
maybe never got billed, or the insurance company gave us the runaround, which is what a lot of it was, is that they would deny it. I mean, even a Medicare would deny it when it's clearly covered, but they just it's called rationing through inconvenience. They make it so hard to get it. So that's how they save the money.
Yeah, and maybe look at that 50 over 360 and how much of that is over 2 years old and 3 years old. Because that's really, if it's 2 or 3 years old, it's still sitting on the books.
And then we're further subdivided in those that are environmental permits, if somehow, and there probably aren't any or many of those. If there is one, then they may know already that business is gone. They closed or that person's died. So if they're environmental permit fees, that's all completely different track. But it can be sometimes big dollars.
So I thank you for the conversation about the insurance collections and the bad debt that we need to resolve. But obviously I looked a little forward to the March reports. And the fact is that even if you take out that $100,000 of billing that we still are, owed, the fact is that the deficit continues to grow. And so I know typically we go through the March financials and maybe we can do that before we vote on the February financials, but maybe we go through that. But I'd like to talk a little bit about how we start to resolve that internally, and in particular, how do we start to constrain operational expenses, simply because that deficit is continuing to grow. So Amber, if you'd like to go into the March financials so we can get a look at that, and then we can further discuss.
So March, we are 75% through the fiscal year. We currently have an unreconciled balance of 330,000. Your reserve amount should be just under 375, so you are short about 47,000. In March, we gained revenues of 34,000. Salaries were at 95, and operating expenses were at 16, for a March deficit of 76,000. Fiscal year to date, total revenue is 152,000, which is about 22% below budget. Salaries, 997,000, which is still 3% above budget. And operating expenses at 257, which is 2% below budget, for a total deficit fiscal year to date of 402,000. Now, similar to February, your accounts receivable is 101,000. None of that represented anything over 10% of the balance. All of them were smaller amounts. And again, in April, it has almost doubled. So we've seen a lot of revenue or a lot of billings in April so far. All right.
I'm sorry, say that last line again, please, Amber.
So in April, as of today, your AR has over doubled what it was in March. So just in the first 2 weeks of April, we've seen a lot of things get billed, which means your revenue in April is going to be increased by a bit.
Okay. Do you know what a bit might rhyme with in numbers?
You're looking about 170,000 so far.
Okay.
Is that state of West Virginia building?
That I do not have the specifics on that.
That's 170 in revenue, April month to date.
That's how much your AR has gone up. So that's, I'm kind of applying, since I know that's all going to be revenue. I was only looking at AR.
I see.
So that's how much it's moved up. So we could see about $170,000 in revenue. And Dr. Reed even said we billed what, 180 so far in environmental. So we could see an increase in April.
So even though with that, though, it's still not, for obviously our fixed costs, salary and wages and operations expenses continues at their pace. That's still not making up a $402,000 deficit, even if you doubled the revenue that you've collected in the first 11 days of the month.
Yeah, not quite gonna cover it, but it's closer than what it was.
What is the estimated number to come in from environmental on those permits?
It's gonna be over 200,000.
Yeah, that's kind of what I thought it was. I was going to look back at
So-
the previous year.
So this is gonna be part of my later presentation, but this may be a good point to go to my PowerPoint. I just have some graphs to touch on what's also.
Let's see.
I do know that the environmental permits, for fiscal year, got billed as of April 1, all of the facilities for different areas.
Everyone else, all the invoicing columns.
I do not.
Yeah, that might be.
What's that?
That might be part of a big chunk of that 170.
They are, I do have their all in good works. Because we have.
Sorry, it's a little hard to hear, Alexis.
The environmental permits are already, the invoices are already in QuickBooks and they have already been sent out to our facilities beginning April 1. So I do know we can get that
Can I get
number.
We can just do the last slide. I'll start. So that.
So the budget looks like fees for services 309.
That may also, I don't know if that also includes our septic permits, because the facility ones are billed separately. I don't know if they put those two numbers together on that line item or not.
Fees for services is 39 and environmental health 309.
So your environmental health usually budgets for 450,000.
Right, exactly.
Yeah.
All of those permits is about.
Yeah. And if the 170 is all environmental, then you're only looking at $100,000 deficit
So this line,
on the budget for right now.
so on the PowerPoint, I showed something similar to this before, is our permit fees, which is one of the line items on your, was 117,000 at the end of March. So that's the red arrow just before it shoots up top. What is in the QuickBooks now in that line item is now 300,000 this far into April. So this is
Okay.
a week or two later or earlier than the preceding 2 years, that big income jump. So by my looking at QuickBooks, it looks like that's already closed. And that happens every year at this time. This is when we send out the bills and get the payments. And so all year long, we're worried about that because we don't get these until we send out the permits at this time, which starts for their permitting to be open starting July 1st. And I'm looking at Alexis to be sure I'm saying it right.
So their new permit starts July 1st. We start billing them April 1. So we give them those few months leading up to July 1st to pay. So you'll see some facilities that won't pay until literally the June 30th deadline. And then there's always a couple that people will come in a little bit late.
Yeah, that number of actual dollars billed on April 1st is a key number for figuring out kind of how far we're able to close the gap, assuming that's all paid by the end of June.
And so that red line is this year, and that's what's now in QuickBooks as the line item here that's 117. Now it's at this year to date. So that's closed a lot, which is what we expected, but it's nice to see it's there. And then I'll have to verify, is that actually money we received and put in the bank? And I'm not an accountant, but so I feel pretty good about where we are on the environmental fees. The next big chunk of money is that QRT grant funding that I say it's probably around 100,000. And that and that'll help close this gap.
And has that been billed, the QRT?
No,
That has not been built.
Oh, okay.
That is something that Brenda and I need to get that submitted by Tuesday. It's
Okay.
job number 1.
So am I to assume that we did not receive any funding from the county commission?
We did not have.
Correct. We did not receive any additional funding. Can we go back to the beginning of the PowerPoint? Everyone can see the PowerPoint? You can see that okay, Ann?
Yes.
So this is so our current budget, this is how we budgeted. And so we can see that the federal money, which a lot of our grants are federal, even though we get them from the state, I'm calling them federal. So those are 5 or 6, 7 different grants, and that's maybe a quarter of our income. The state Aid is 400 or so $1,000, and that's been fairly consistent, sometimes shifting by 100,000 depending on what the state does. And we don't yet know where it's going to be for this coming year, and we often don't know till the end of June, because there's some back and forth. But we're assuming it's going to be about the same, and so that's about a third of our income is dependent on the state funding it, and that's true, I think, for health departments across the world. Is that a lot of what we're doing is not billed for. Local, I've got two local charts. This is the one of the amount we get from local, and that's $20,000 that we get from the Board of Education, and that's been the last several years they've given that. And then private is the permitting fees we just saw in private medical insurances. So it's anything that's not a grant. The next.
I think
Next
it's
slide.
important going forward to parse those two out. So much of the operations dependent upon a clean revenue cycle on commercial billing for healthcare. That's a completely different animal, the environmental service. Those are two, like, I almost think we need to see the distinction between those two.
Mm-hmm. And so we can try and come up with some things like this and then talk about, what's the clinical bad debt or just not paid yet. And that'll be, partly reflective of our capabilities in managing that, largely reflective of that. So this is if we add the in-kind that the county gives us. It's not a line item on our accounting, but the county does give us the building and the support for the building, custodial services, lights, paper towels, all that. And their value now is increased from used to be 70,000, now it's 106,000, but real estate prices have gone up, and there are deficiencies with this building, which is recognized, but it's also good space in a lot of ways. But so that's still 8%. The next thing, this is just a different form of looking at the same things, our income sources. And next. So still what I would say is a relative.
If you're moving slides, they're not moving on the screen.
Oh, okay. Can you see if you can help that?
I'm not exactly sure. How are they not missing?
I think it might be because you've got the graphics selected on the slide, or at least that's the way it's showing on my screen. So if you put it in presentation mode, it should be able to advance properly.
Slideshow. Share.
Are you looking at speaker view at your end?
Can she
Karen?
see this?
I can see the Jefferson County Board of Health FY 2025 budget source of funds right now.
She can see this.
And
Okay.
it's not in presentation mode. If you go down to the bottom right, and there's a little,
Slideshow. That's
Yes.
what we were doing.
yep.
It's weird, but it wasn't showing.
Okay. Does that help?
Not yet. No, it's not. But
So,
as long as we're on the right slide, it doesn't matter the view, but I don't know if we're on the right slide.
You can share a particular window. You might be sharing the wrong window.
I don't think so.
Do you want to come?
Share. I think so. Screen one, that's us.
This is
Okay.
like me asking a bunch of young people, can I help you
Share.
There we go.
You see that? Okay.
And
Okay.
change to the next slide too.
Can you see this slide?
I see side 4 of 9,
Okay.
5 of 9.
Okay. Which slide? Are we on the right one? One? Okay. Thank you.
So the local funding is still lower than many county health departments have funding, and there is no one standard. It's variable. There are a number of county health departments that do not have much funding. Others have funding by their county and municipalities. And we will try and get some actual data on comparisons to present to the board and to the commissioner. But next slide. So political income, we do not specifically, so all of those state and federal grants, that is not specifically allocated to this service or that service for the most part, or I didn't put it in here as well. We'll get a refined thing that looks at how our different expenses are covered by different, but private is a large part of what we get our sources from and the federal, the state grants. That's a big overall that just is a big bucket that we cover the rest of our expenses, whatever is left over. Next.
Where does Medicare and Medicaid go?
So that would be under private. So that's meaning it's an insurance. It's a third party payer. Okay. It's not a state grant or federal allocation.
All right. So the federal dollars in that last line is in Medicare or Medicaid.
Right.
Billing.
So when I'm saying, so it's federal grants, I should put that to be clear. So I'm just looking at the clinical. It's third party payer, whichever one it is, and there's so many different plans out there.
And this is budget.
This is
actual.
This is actual. This is the budgeted income for this year.
Okay.
So it's
so we budgeted 300,000 healthcare delivery.
Right, and so that's when you look on our line item where we should be. Next. So this is actual what we've earned from our year to date in private immunization. So that's one of our big things. And you look at the number and you say that's a lot, but then you look at our vaccine expense, because that's a big chunk too, because we pay for the vaccine, add a surcharge, and then pay for administering it. So if you look at the past 2 years, so there's been a big difference in the amount of vaccines we've given. The income from it, the amount we've made, has been about the same. And I think some of that difference, I don't know that, but I think some of that difference is in 2024. So last year, we gave a lot more vaccine, but I don't think we were as efficient in collecting the money for it, the charges. I don't know that for sure, but so I'm hoping what this means is we're doing better on collecting that $40 here and there.
And it looks like the request for those vaccines is way down as well.
Right. And I'm not sure of the reasons. The vaccine acceptance has certainly been a real issue in public health. So there's a lot, certainly for COVID, there's a whole lot fewer people than there were in the preceding couple of years. And I would say there's a whole lot less need than there was a few years ago. So that's but there are a lot of other vaccines that people should be getting. We're starting to see more adults coming in wanting a measles vaccine because they haven't, they're getting very worried and they aren't sure what they have and they want a booster. And so there are different circumstances where that's appropriate and others where it's like this isn't needed. But and it's not huge volumes, but it adds up. Ordering that more than we did. So that's just, so this is the kind of detail I think you're kind of looking at is, where do these pots of money and what's happening with it. And I think the efficiency of billing. Next, environmental income is, we do get a bit of a federal grant, but these are the different types of things. We get different fees for service, like complaint investigations or Alexis can speak to that, you know, but they have different things. We have, information requests that people pay, you know, $25 here and there, and it adds up. A lot of information requests, and food cards. But these are just different sources of income. The permits, as you can see, it's, as of this year, it's now 300,000 counting the April. So that's their big revenue source. That doesn't show up till this part of the fiscal year. So we always look behind. And one of the things we're talking about in the budget is trying to reflect what's in the monthly budget as not that $300,000 in July. It's not expected in July. We expect it, you know, gradually through the year. And the next, and that's what I just talked about, is that those fees come late. Our grant fees come in predictable amounts here and there, often quarterly. Some show up almost automatically. The state aid, the $400,000 state aid, comes in quarterly allotments pretty predictably. Some grants that we get, you bill beforehand. Most of what you get, you wait until the service has been rendered, and then you can't charge for it until the quarter is up. So that means we're always a little bit behind on that. But eventually it catches up because you're getting things from several quarters ago. But so we'd like to also be able to put them in so you can see where these grant funds are instead of just mentioning grants. And that's it, I think.
Any other discussion on the financials?
Yeah, I just want to recap. If we're at 400 preliminary for March. Yeah, there's 100 in QRT. There's almost 200,000. I guess what you said is we're right about $100,000 deficit right now.
Exit out.
Yeah.
If we kind of look at it as of April 11.
Yeah. We're looking at least closer to 100,000.
Yeah, I know we're back with him a little bit at this point, but is there anything anticipated, any other things anticipated between today and the end of the year that would further close that gap?
It's some other grant.
So that's something I wanted to bring up too, is when we look at these grants, we're looking at previous years, what has been a lot of the state has changed that amount for certain things. Like our one, I want everybody to know is like our QRT grant from fiscal year 24 is not the same amount as fiscal year 25. We have to take those sorts of things into consideration when we do talk about this deficit aspect of it, because we could have in fiscal year 24, we could have $179,000 in QRT, but fiscal year 25 is only 125, something of that nature. So remember allotting those differences in it, and plus grants that are no longer available to us that we look back upon, right? So there's a in there, there's a underserved communities grant that we got fiscal year 25 for. That's not a thing anymore.
Did we budget for that in fiscal year 25, anticipating that we would get it?
We're just looking at in general, like
No,
comparing.
there may have been like some residual monies
Yeah.
that hadn't been paid yet, so that may have, but I don't.
And when we do like our proposed budget for this year, we're basing on what we hope that the state does. And I can tell you now, you know, we have lost $12,500 of our immunizations grant. They cease and desist as of March 24th, no more money for that. Fiscal year 25 or 26, we will be getting an immunizations grant, or IAP is what they called it. But that money's going to be different. We don't know yet because the state still, we have to wait for the state, right? There is another grant opportunity for influenza of $8,500. Again, we're hoping that hopefully makes up a little bit of chunk of change. But those aspects we do have to take into consideration as well. And plus we can only bill out what we've actually done. So we, if we haven't done anything in grant A, where we've only spent so much money in grant A in a quarter, that's all we can bill out for, even though the grant could be up to a certain amount. It's not anything, amazing, to talk about, you know what I mean? There is another awesome opportunity, thank you, Alexis, that we do have. We do have, roughly $20,000 in a NEHA grant
This is coming in for reimbursement of last year,
for reimbursement, okay?
20,000, and this morning we got a deposit of 5,576 for our training costs of last year. And then we also got approved for the next 3 years. We're gonna get $20,000 over the next 3 years for environmental health service activities, and then we also got approved for an additional $3,500 for this calendar year training for EH staff, which is very helpful. It'll help us with the new guys that just got hired. We'll be able to apply some of those funds to their training that we've already incurred expenses for, but we can now bill and get money for.
Can you explain NEHA and how that money comes into existence?
This is the National Environmental Health Association, which we've talked about. This is the grant that I've been waiting on that update for over the past few months. Thankfully, we did finally get our award, which began, actually, it was awarded retroactively. So we can bill for costs that we've incurred as of January 1 of this calendar year, which is great. And we do have a lot of hours that I can already apply to this grant. For that first wave of $20,000, we can go ahead and invoice the National Environmental Health Association for that money up front. So we could receive that as soon as next month if everything moves smoothly. And then, like I said, the other monies, that $20,000 and that $5,500 is for last calendar year's expenses that they're finally being able to reimburse us for.
So it sounds like an extra 25,000 towards that 100, so we're kind of at 75. And then you mentioned the amounts changing on the budget, where if we budgeted 180 last year, we got 180, so we budgeted 180 but only got 120. Like, was that a scenario, or did that actually help?
It's just a general scenario.
Because that would cover at least that would be able to logically get us to
Yes,
where the gap is in the budget. I'm trying to just close that gap logically.
totally understand, and that's why I was trying to help explain that there may be deficits that in the budget, but not necessarily because we haven't billed for it or anything like that. It's just the way, like, if we spend, say, again, our grant is 180,000 and we can bill per quarter. It's Friday, I've been on jury duty, I apologize, my brain doesn't do math very well right now. But a quarter of that amount, we can bill for Q4. But if we haven't done enough to cover that full amount, we can't bill that full amount. We'd actually have to give money back to the state, and I don't like giving money back. So those aspects, so we may be shortchanged $10,000, $20,000 here and there. That could explain a couple of little gaps overall.
Didn't we have a NEHA grant that was also paying for these new sanitarian hires, and that was sort of trickling down as well?
We had
Yes.
one a few years ago that specifically covered one hire.
Is that over now?
Yeah, that was the previous 3-year award that ended at the end of the last calendar year. And we had anticipated this grant coming in a lot sooner. So those first 4 months were coming from our general fund, but now we can retroactively apply these monies to those expenses. So it's basically gonna even out what this was unplanned, an unplanned extension of not hearing about these grants, but thankfully we did finally get the money that we applied for. And it was on target for what we expected.
Well, the environmental department covers all of their costs with all these fees. And helps to
Yes.
contribute for other operations
Correct.
of the health department, which I think sometimes people don't always understand that you are covering all of the fees for your employees
Correct.
or the people that are doing those things in that department.
I think that's a great point. When we kind of look at the two major buckets and functions of the health department, kind of almost needing to see the financials kind of split out by class or by service line is the term we would use, and kind of what is the fiscal health of environmental service, what is the fiscal health of healthcare delivery, can kind of help us, provide better guidance and support on, how to navigate some of that.
And then there's some other pieces, the threat preparedness, the reportable diseases that we may put under one umbrella or another, but reportable diseases is presently mostly done by a nurse. It can, much of it can also be done in environment. Animal bites are done in environmental. Some foodborne outbreaks, we plan to have them done more by environmental, though our staffing is short at the moment as far as
We're so close. Just like one
budget.
more month.
So there are a lot of other things that we do that aren't billable in any form. And that's where the money from the state impacts us a great deal.
Is there a motion to accept February's financial
I
report?
move to accept February's financial report.
And second,
Any discussion? All those in favor say aye.
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 And
Thank you. All right, what do we got next? Thank you, Amber. All right, Dr. Rudy, do you want to go through the agency reports or do you want to go back up to unfinished business?
agency reports, and then because the other two items, Mr. Rhodes and I will be both presenting those.
Okay. All right, then we'll kick it over to Alexis then.
So like I was just saying, we have about one more month until the 3 sanitarians that are currently in training will be hopefully fully licensed upon passing their comprehensive exam. That will take place on April 26th, I believe. And then they still have to be cleared. A state official still has to come down here, travel all the way here and evaluate them on site, just to make sure that they are able to competently perform their inspection duties in the field. Unfortunately, we don't have the option of allowing the manager to evaluate them. They want it to be an unbiased party that comes out and makes sure that they meet state standards. That's just the way they decide to do it. Obviously, there's only 3 people that are working for the entire state right now, and this is a very large sanitarian class. So, with that being said, my goal is that by the first week of June, I will have all 3 of them complete. But it wouldn't be outrageous to anticipate that due to scheduling challenges at the state level, it could be drawn out into potentially the end of June, maybe early July. I really, really hope not, but we'll see what happens. So with that being said, we are down a total of 3 functional sanitarians as of this month. I would like to issue a congratulations to one of my senior sanitarians who is out on maternity leave right now. So she will be out for the next 3 months and will rejoin us the 2nd week of June. But unfortunately, that does leave me and Mason as the only functioning sanitarians on our staff able to complete sanitarian duties. And our volume of requests is large. So.
Alexis, is there any opportunity, and I understand you said there's 3 people in the state that do these certifications or final whatever sign-offs. Given obviously the volume that you're dealing with, and especially in advance of the impact fees, which is probably contributing to some of this, is there any way to have a conversation with the state saying like, look, we have all this stuff that has to be done before June 30th because of what we've got going on locally? Is there any way to help make the case to prioritize?
I have had a conversation already with a district sanitarian who is stationed in northern West Virginia, and he really wants to prioritize me. But unfortunately, those assignments are actually made by an upper level official, who,
In what agency?
at the top of Office of Environmental Health Services. So she is in Charleston, and I have asked for a meeting with her to get that straightened out. I'm hopeful to get some conversations with her soon. But the actual sanitarian that is doing the evaluations is really pushing to have us be one of the first counties that gets the certifications moving.
Do we have a regional sanitarian now?
We do not.
We do not.
The evaluation is taking place by a regional sanitarian. There's currently 3 that are working in the entire state. 1 is in Charleston and 2 are in Vermont.
We should have one here, but that position is open.
I have inquired about that. They had planned to open that position in September. I don't exactly know what happened to delay that. But the last time that I spoke with the Office of Environmental Health, they essentially said that filling that vacancy is not the top priority. So,
And this vacancy has been much of the last 2 to 3 years. It was
Or more than that. Yeah. It was vacant when we were trying to hire Gillian. It dates back a number of years.
I can tell you they are well aware of the vacancy and the stress that it causes this region. We are very vocal about that. But as far as last month went, I can tell you I did my best. I did 24 inspections in food and 11 Gen San inspections. I responded to a couple of complaints, mainly sanitation stuff, not necessarily labor intensive things. I didn't have any closures last month. I did have a couple of follow-up inspections, just for routine violations, things like that. But I can tell you we are not where I would like to be in terms of inspection numbers for this month. And that is just purely a staffing issue. I have Mason full-time on septic. If we look at the septic program, it's a doozy. We did get 7 applications for subdivisions for a total of 62 lots that we looked at in 1 month. Or excuse me, that's 62 subdivision lots, but we also did an additional 27 well and septic site evaluations outside of that. So well on our way to almost 100 total site evaluations just in septic. Thank you, Mason. He's very, very hardworking. And he also went on vacation in the month of March. So that was
He got a vacation.
that was that many with only 3 weeks of work. So you can see how busy we are. Right now we're booking septic appointments about 3 weeks in advance. And I've also taken on 2 days a week. I'm taking on some afternoon septic appointments just to try to keep it from accruing a backload. Because we want to make sure that we're getting these done as fast as we can and meeting our timelines.
Is the state willing to send us someone from Charleston to help with any of this?
So that would be the district sanitarian,
Okay,
which
yeah, okay. I thought, I wasn't sure if that was different or not when we've asked for help from the state before.
the state, let me put it this way, district sanitarian position, it is necessary because in the event that there are staffing issues, it then falls to the district sanitarian to fill in the gaps to make sure that the state mandated services are able to continue. However, in the event of a vacancy in that position, there is not a backup plan for who then steps in to fill the gap. So essentially, if they do not have the capability to staff a district sanitarian, we're kind of just on our own. And we're doing the best we can with that. I do anticipate that this is going to get better though. Yeah, go ahead, Karen.
So question on, and sorry, again, because we've got this July 1st looming impact fee situation. If people have their documents and applications into us prior to June 30th, are they still going to be grandfathered into the non-impact fee? Or if we have to push past July 1st because of, these our staffing issues, are they now then going to be subject to impact fees?
I think that's the,
Yeah,
someone
to
at the
be
county would
honest,
have to
I
decide
couldn't
that.
answer that, but what I do know is that the Office of Planning and Zoning is currently booked 3 months in advance for permitting. So with that being said, I would have to assume that there's going to be some type of understanding that if you get your application in before that date, that you wouldn't be charged those fees, but I couldn't possibly, answer or confirm that. But I do
Could
know.
could you call over there and find out the answer to that? Because if it's not addressed or people are assuming one thing, but it becomes another, it's going to be even a bigger cluster. So just if we could get an answer for that, because if they are not going to honor applications that have been put in a timely manner, and we need to address it with the county commission, I'd rather see us be proactive because we're gonna get the brunt of it if those that are building end up having an exponential cost added because of the backup of staffing, which is not our fault. Um, so it would just be good for us to get an understanding of that, and if we have to talk with the county commission of how to address it if there is in fact an issue.
I will get an answer for you.
Thank you.
Are there any other questions for the environmental report?
I do have a question. Who's your point of contact that you talk to on the planning?
That would be Becky Burns.
Okay.
Thanks for all you do. I know it's been a rough road.
The department's good glad to have you and Mason out there, continue to keep things moving.
That you,
Yes, thank you, Alexis.
you've definitely been through a lot. And in addition to that, she's working on policies and other administrative things and involvement with the rest of the agency, not just sitting in her corner of the building. She's not sitting there much at all. She's out in the.
Yeah, I don't sit down too often. This is probably the most I've sat down all week.
Great.
So I just want to start off with talking about the upcoming cybersecurity grant. I feel also need to give this to you, Brandon. Sorry about that. I might have missed you earlier. I also want to apologize that I was not in for a little bit. I am one of the 3 sanitarians that will be in training. So I'm doing this half and sanitarian half. So I do apologize. I might miss any other future meetings as well, but give you a little bit of update on the grant, just an overview for anybody else who hadn't heard about it before. It's a state and local cybersecurity grant. For us, it is mainly used to upgrade our cybersecurity and security infrastructure. And the main portion of what we're going to use it for is basically buying new technology for the health department, such as computers, iPads for the environmental health side, mobile hotspots for us to go at vaccine clinics, and among other things. The grant itself, we are allocated about $5.3 million if it is awarded. It is more of a thing where it's a purse of $5.3 million and we just take out the money when needed. And I've been putting together currently the stuff that we need and what funding need to be sent out to them. And the deadline for it is April 30th. I have pretty much everything put together. Just got to send it out to them, and if they decide they like us that day, then I guess go through with it. But that is the main part of that update. As of right now, we're just getting all the prices for everything, such as, like I said, computers, and the iPads and everything. And once that's all put through, I'll send that in and hopefully get it. The only thing with the grant, just to put it through a little more, is that this is not a yearly grant like some other grants. This is the grant where it's purely you need something, and let's just say the iPads are about $1,200. They will give you the $1,200 if awarded and just compensate for you, but it is not going to be something like $20,000 each year. This grant will go through towards 2027, so we will basically be able to take whatever we need out until then. But that is the main update on that end. And besides that, that's really what I have to go on.
And that's a federal grant administered through the state, and it's for, not specifically for local health, it's for local.
So it's for state and local entities. It is basically for anybody who, and like I said, it's only for cybersecurity and network stuff, not for physical infrastructure. So we need to remodel the health department or buy a new building. Unfortunately, we cannot do that. But that is what, and it's for state and local, so it's not that we're not going to be going once you're taking the money out of it. But there should be more than enough money that we should be able to get.
Does this have a cost match on it?
If I remember correctly, yes. It is in that packet, but if I remember correctly, yes. I'll have to review it again. Better idea on that. And for Karen, Dan, and Elliot, I will forward you guys the packet as well on the email, and so you guys have the information as well on that end.
Thank you.
And this is, you came across this contact at one of your,
Yeah, it was, yes, it was at the IEM conference in Colorado. I was able to
guys do some work there.
Yeah, I was able to get together with the cybersecurity infrastructure security agency, and they were able, or CISA, they were able to guide me on what we had to do and what our requirements are. And like I said, they got everything together. Hopefully they will give us funding that we need.
And we'll probably continue to want to work with them because we anticipate that when we move to the county, the new county building in about a year, is that we'll be switching our internet from being done by the state to being done by the county. We don't know that, but that's probably system.
And that this is made in anticipation for whenever that happens. I'm hoping it's before 2027. We don't have to run into that whole issue with that, but as long as it's before that, that is the anticipation that we will use this money for that as well when we get to it.
Okay, thank you. Clinical?
So Lindsay and two of the other nurses are at annual training that the state has every year for about 3 days. So I'll give the report. The activity report is there. Nothing has changed much. The big news is the Office of Health Facility Licensing and Certification, OFLAC, has given us the approval to start going ahead and offering medication for substance use disorders. That's largely buprenorphine, or the brand name Suboxone, which is a partial agonist or partial opioid and partly blocks it. So it's a controlled substance that the state has more strict requirements than the federal requirement for who can prescribe it. So we have to be licensed or registered. So after we have seen 5 or 6 people for this, they will send inspectors out to look at what we're doing, and then giving us hopefully then a 1-year license to do it. They will be inspecting whenever they want. We have to follow state protocols, all of which we've had to write up as protocols for us. So it's a kind of a big deal. We've been working towards doing this for over 1.5 years. We will be largely treating people with Medicaid, which would be fee for service, and so we've already done a couple of people with this previously, and we did check, and our bills did get paid by Medicaid, so that's nice to know. The we'll be following that as a cost center. It's certainly not done as a reason to make money, but seeing patients would be part of what offsets the salary of our nurse director as a clinician. The other thing that's happened in that front is right about the time we met with the county commission to ask for some money, they got informed. So this was mid-March. They got informed by the Jefferson Day Report, which is a private not-for-profit that has done the handling of people who are on parole with substance use disorders, and part of their parole is that they are getting treatment. So they have been doing that for a number of years, getting grant money as well as insurance payments. The grant money is largely through Department of Justice, my understanding. And they usually apply for the grants. I think they get some extra county funding, but I'm not sure on that. But they apply for the grants at the end of March. So about 2 weeks before that deadline, the county was notified that they were going to stop operations after June 30th. So at the end of the grant year. This is a major issue because these people otherwise, if they aren't in treatment, they have to go back to jail. To put it simple, obviously each case is a little different. So the county scrambled, and they have, and I can't speak for them, but my understanding from discussions and what I read in the paper is that the Berkeley Day Report Center, which is run by the Berkeley County Commission, has applied for those same grants for this next fiscal year, and they will be providing the service because it's a complicated thing. You have to meet all sorts of requirements. They'll be doing it with assistance from the county. We've been asked to, what our role could be, and so those will be ongoing discussions. Obviously, right now we can't commit to anything else unless there's some sort of funding for it because we're behind budget anyway. One of the ways that we may be contributing in the short term is these people need frequent urine drug tests to be sure they're not using, and that becomes a lot of time involved in doing that. So we might participate in that role. That would be an ongoing thing, but we have to be sure we have the space, the personnel. We have to be sure that our relationship is not, if we're treating people that are on parole and we're getting paid by the corrections money, then what is kept confidential may be different than in the usual mental health setting. So these are complications we have to address very carefully. So it's but that is certainly something we'll be involved in some manner. But it's we already have 2 peer recovery coaches who are working with the population. So it's not as if this is a brand new thing. It's been working towards it. You had mentioned the regional sanitarian vacancy. So there's a regional epidemiologist position that's been vacant for about 3 years. So that's something that when we have a question about a reportable disease that we're following up on, we don't have a single point of contact, which we used to have. Just a couple of weeks ago, an announcement was made of an epidemiology grant that was awarded to a number of different regions in the state, or the different regions in the state could apply for it. The eastern region was not included because we don't have an epidemiologist, I guess. So the idea that we're getting forgotten does come across to us. We need assistance. But we're continuing to plug along. We do not yet know exactly what's going to happen with school vaccination policy this coming year. We'll wait and see what happens. I can't predict that. I expect there may be some way that some people can get their child in school without being vaccinated. So we may see fewer people in the surge of July and August vaccination appointments. We're uncertain about that. That's the main information from part of the problem with the regional epi and regional sanitarian is the Bureau of Public Health has a large number of vacancies that they can't fill. We're not really part of what goes on there, being not a state agency ourselves. To me, this is part of the underinvestment in public health if you're not paying the staff. And I do think that from the conversations I've had, part of the reason we don't have these regional positions filled is people don't want to live in the Eastern Panhandle for Southern West Virginia living rates, salary rates. So the pay differential is a significant piece.
So Dr. Reedy, with the vaccination situation, I mean, if we're anticipating potentially lower numbers of vaccination needs, are we going to, I'm assuming we're going to adjust accordingly of how much we purchase, correct?
Right. That's done on an every few week basis, or even the administrator may weekly get a vaccine invoice request. So we try and keep our stocks relatively low because it's a lot of money. We don't want the risk of $100,000 of vaccine in the refrigerator if there's a prolonged power outage, in which case they'd all be wasted. We'd rather keep it at a lower amount. We also we want to have as close to possible just-in-time stocking. But yeah, we want to keep that low. So we're
okay.
But unfortunately, sometimes there's a minimum volume we can order. We just had a question about the Mpox or monkeypox vaccine. So the minimum we can order of that may be 10 vials. And that may be okay if the shelf life is 2 years, but not if it's 2 months, because then it gets wasted and we have to buy it. It's not that it, so we have to look at each of those things about whether we offer it.
Thank you. Do we want to go to the administrator report first, and then we'll go to you last, Dr. Reedy, so that you can deal with the unfinished business items.
And so, so the administrator can give his report and then he can talk about the coming budget item.
Okay. Yeah. So just a heads up on that first month in, drink water from a fire hose. Awesome time. But I appreciate everybody's help and everything in my first month. I've got to meet with some of my counterparts of the region, which has been really helpful. Getting out our infrastructure grant for fiscal year 26. Kind of keeping me abreast of the situations going on. That as an administrator, I need to know. So it's been really great information out there for me. There has been some budgetary changes that we've talked about a little bit earlier. The state is stop off that Q4 IAP grant. That's to a $12.5 thousand loss. We do have some billing challenges that we are currently in the midst of adjusting, and that's one of my main goals is to get our billing situation in a better position. You know, we can't run how we've been running, right? So one of the big areas is that we definitely, met with the county commissioners asking for funding. Unfortunately, again, they didn't fund anybody, so we didn't feel left out. It wasn't a personal thing. But we did meet with Edwina, discussed a little bit with her after the finding out of the no county funding. There is a possibility with the grants agency that the county works with to possibly do a community health needs assessment and to help us focus on where we can maybe focus in on our scope of prevention efforts. Because we do get a community health needs assessment from WVU Med, Valley Health, all these. It's a little bit broader and it's a little different than what the actual community may need from us. So hopefully that'll be a very good endeavor to help us kind of focus our scope of prevention in public health in our health department. Met with Jefferson County Community Ministries. They were a awardee of a opioid substance use disorder grant. They requested 480 some odd thousand. I think they got 82,000 out of that. So working with them as a coalition, also with a couple other members, NAACP being one. Bob worked for Dr. Reedy.
So the Shenandoah Community Health.
Yes, there's
one, and they want to include WVU medicine. So these are people who are working together with them anyway.
So, getting up, obviously broadening our scope and broadening our outreach and support, where we can, even though it's not a financially compensated situation, but still getting us out there in the community as best we can be, especially being our location currently until we move. Working with the accountants here, getting a broader scope of our funding has been one of the main priorities in my first month. So we're again going back to increasing our billing infrastructure, getting better at that, and doing what we can do to be, not in the red. We do have an audit coming up as well. That is when we find out who it is and when they're going to be. Everybody will know that as well. So we will all be on the same page for that. That's pretty much my update for the first month. So any questions? Right. We do have a proposed budget. I think that's it, and things of that nature. So
the budget, I don't have anything in writing to give you. Mr. Rhodes has additionally, did everything else, he got assigned jury duty this week.
yes.
And next week too, or?
No, just that I'm done. Today was the last day, and they didn't need me.
So three of the days of this week, he had to be away on jury duty.
Yes.
In Maryland.
Civic duty and all.
So our budget will be largely done like the preceding years. We look at the income sources and the environmental fee income. We'll use what we've done this year. The clinical income will use what we've done this year as far as how many vaccines we've actually given, not an estimate that we can do better next year. I think we'll leave it flatline. If we do better next year, that's great. But some items like we usually get 20,000 a year from the Board of Education. Last year we put in 30,000, and we got 20. Until we get 30, we're not going to book 30. So we'll put that in. The grants, this time of year is when we start finding out when it's what we're going to be awarded for the next year, and that trickles in. Some of the grants have been announced, some haven't, and some we have sent in our request, and it's variable whether those are rubber stamped and approved, or they go through it in quite detail. So those numbers may change, but we will change what we present next month as our final budget will be what our current best estimate of it is. Right now, I think the immunization grant, we just assume it's going to be less than it was this year, but we don't know that.
We did get informed that it would be around pre-COVID amount. So we're looking at anywhere from 50 to 75% less than what we have received the last couple of years.
So apparently anything that's tied to COVID is removed. So we're trying to wipe that off. But there are other grants that are going to be coming up, and we'll just have to, evaluate each one as it comes up. There's one for pandemic influenza because there's still a need to be worried about what happens if this one has to do with avian flu or the bird flu. Is if this happens, what are we going to do? And that involves a lot of contact tracing and things that we did during COVID. We already had one case that probably turned out not to be, but we ended up being in investigation mode with that, and that could happen again. Now, this is a relatively small amount of money. It's like $8,800. So that's not going to close any gaps, but at least that adds up. Our salaries will be going up a little, not the salaries. Some of them do go up for merit increases, but we're going to have to be very careful about merit increases at this time because of the income. And then the PEIA insurance, like insurance does every year, is going up. And this is open enrollment season, which doesn't change too much. We also, as far as benefits for employees, we have signed on with the Mountaineer Flexible Benefits, which is something affiliated with the PEIA. So our employees have not had dental and vision, they can get that, but we're not funding it. So unlike the other, we do some matching payments. This would be if people want it, they can buy it on their own. But it's a benefit and it does matter to a lot of people. So right now, I don't see major changes. We do, Ms. Rhodes and I are talking with the supervisors also that should we have vacancies right now with our budget situation, I don't see that we could replace them at the moment. Certainly no expansions unless it's something covered. We will probably be hiring another part-time peer recovery coach with quick response team money. This is a part-time that is the understanding that it's a day by day and there's not even a 2-week notice. This is how we can do temporary employees. We do quite a few during COVID, but that as long as we're billing it, we should get all the expenses back. So it's different than hiring a full-time person with all their rights. So otherwise, we have no expansions. As we look for billing assistance, that's something we're going to have to be very mindful of how we could afford billing assistance. It's a cost of business that you got to invest something here, but that's something we're also considering carefully. That wouldn't wait till the first of the new fiscal year. That's something we're working on right now. So that's where we're going with the budget. So it's much follow the last thing. There are a number of line items in the budget documents you get that are grants that no longer exist. We're going to eliminate those. So this might shrink by half page. Um, um, some of them, I'm not even sure what the grant was. It's been that long ago.
Do we need to vote on this next month?
Next month we'll do it, and that gives us, you know, if there's a delay, it still gives us time, but I'm not 100% sure what the current regulation is or what we have to send to the state or not. But we've got our contacts to help us guide us in that. At the end of the meeting today, if you're available to meet about the audit committee. So we're going to be choosing an auditor for the audit that's required to report to the board for this past fiscal year and the current fiscal year. So
Is that a state generated audit?
It's one through the auditor's office, one of their chosen private auditors that we sent out, following their guidelines. We sent out letters to all of these people, and we got some replies, and then per their protocol, we evaluate them and select one. And then after we get that report, it's to the board, but also to the county commission who requested our last year's audit, but we didn't have it in. So that's the budget piece. Want me to just move ahead to the next item?
Yes, please.
And by the way, thank you for waking up so early today.
Thank you. No problem.
You're not here. So we, just before the last meeting, we had an assessment by the Bureau of Public Health that they, prior to the current fiscal year, the Bureau required us to submit a program plan each year. Last year, they did not require that, but said that we would have to have a plan that we wouldn't submit, but that we would then be evaluated after a year to see how we're doing on meeting the measures of what we're supposed to be providing according to the state law. And so they came to do that. They're doing it with each county. They've not done this before. It's not as involved as a joint commission inspection of the hospital, but then they haven't been doing it for decades. They took the state code and broke it down, and I think I did. I'm not sure if I sent that to everybody. If not, I will. They broke it down into just individual line items, and then came and asked us about each of those and asked us for documentation. They told us beforehand what we were going to need to have. And each of the items they asked to see. And of the 60 some items, there were 2 that they found us lacking in. I did send that. So they sent, a few days later, they did send us their report. And I have in one of the local board of health annual self-assessment. So they're saying we can use their assessment of us as our assessment of where we are, which is fair. It's, you know, we agree. Our nurse director, environmental director, myself, and one of our nurses who does the communicable diseases and tuberculosis was involved in meeting with the one staff person who came. So the 2 items they found lacking is we did not have the annual plan. So we did not have an annual plan that was written up and signed by the board for what our program plan is. So our response of how we're going to correct that is we're going to have one for this coming year. And that will be one that we present next month along with the budget, and not only with the budget. This is and the budget becomes part of the program plan. But there's also what are we doing other than the numbers? And the big part of the program plan first is all the required things that we have to do. So a lot of these are not money-making things, the things that just are expensive, but they're considered essential public health duties. And that includes everything in environmental. I don't think there's anything you do in environmental that's not required. Not much. Yeah, in the clinical, there are some things we do that we don't have to do. We have to give vaccinations. We do see people for sexually transmitted diseases. We do not have to offer family planning, although there is a expectation of a lot of places that we do that. We have to offer tuberculosis testing and helping with treatment on that. So there's several things that we're required to do as far as clinical activity. A big area is reportable diseases. There's certain diseases or conditions that we have to follow up on. Some of the ones that we have to follow up on, actually the state does that. We don't do it. There are certain gray lines. Other areas such as treating people for hepatitis C, or doing diabetes care, or doing treatment of substance use disorders. These are all variable. We could offer car seats to people, to mothers with infants. There's a whole list of things that we could do, but it's really any fee for service that a primary care person could do, we could do. The question then becomes, do we meet the standards of being available after hours? So if you're offering something, can you really provide the service that the profession expects? And that's a big no in a lot of cases. So what we put down as far as these other things, those would be specific items of what we're planning to do, listed in a document instead of here and there. And so I'd like this to be fairly comprehensive of all the different types of things we do. Outreach to vulnerable populations, participation in community activities such as the local emergency planning committee, the counterterrorism committee, other things that we're expected to be involved in. Environmentals involved in different county committees, the nuisance committees. It's not the committees of nuisance; they take care of nuisances. So that would be in the plan, which is as much a good primer about what we do. We don't have that right now.
It almost become like a guiding document for the year.
Yes.
Yeah, I like it.
And then environmental health, our one deficiency, which is no shocker, is that they asked about, you have how many food inspection facilities?
About 130.
So 430, and they picked two random names, and they were both ones we weren't up to date on. But so based on risk, meaning, actually tell me what risk means.
So we have 3 categories that we place our establishments in. And that's based upon a couple of factors. Our highest risk category, we save for vulnerable populations. So healthcare settings, our child care settings, or any other type of care facility that's dealing with immune compromised individuals, as well as our extensive food operations. So if they're doing, a lot of raw meats, if they're doing specialized processes, sushi, things that require extra observation and documentation, those are our highest risk facilities. We have about 70 of those. And then we have our risk category 2, which is most every standard food operations. So think like your McDonald's, your Dairy Queen, your mom and pop shop, etc. These are going to be the medium risk categories. The lowest risk is mainly our retail operations. So think your dollar stores, your gas station, convenience store type places, coffee shops. These are places that really aren't doing food preparation or handling or any type of raw materials or things that are really going to have a risk of making people sick. So all combined, we have about 400 total facilities, 71 high. I want to say about 250 in the medium, and then the rest are in the low category.
Tell them about the two they picked. No,
So,
you don't need
yeah.
to give names, but.
There were the two establishments were in the medium risk category. Oh, sorry, I forgot to explain this. The risk category also determines how many inspections that facility gets per year. So the high risk gets 3, the medium gets 2, and the low risk is only once per year. However, based on staffing, generally, all of our facilities are getting about 1 inspection per year. That's not where we want to be. That's not what we're striving for. But we're hoping to at least get inside of every establishment once a year, if not more. So these two establishments did have 1 inspection each within the last 12 months.
So and so we didn't do that. We were glad they had at least 1. And they may have had the 2, except that in November, they would have been due November, December, but we lost 2 of our sanitarians. We've already met partly that deficiency by recruiting others. Now we're training them. So hopefully by July we'll be up to pretty good full strength on that. It'll be full strength with a lot of our staff being new, so it's not quite the same as having 5 very experienced people, but we should be able to meet all of our requirements. But so I had to put forward a plan, and it was very unclear when we had to present this plan, but I've already presented it. It's the improvement plan is the 2 activities. So the one I talked about, giving you a program plan, the other is how we're going to respond to it. And part of it is that if we look at our 2 areas that have the highest turnover on the clinical side, it's our office assistants or front desk billing people is the highest turnover. And that means, a lot of things, plus it's hard to keep consistency if people are learning how we do things and then not being here. So investing in that's going to be important. But the other is sanitarians on the other side. And that's been going on from before I came. I think when Alien came, there was nobody here about custard. So that's been an issue for a while. And one of the big problems is the hiring is only part of it. Because then you have to get them certified, because someone that's hired can't do it until they're licensed by the state as a sanitarian, which requires you go through state-approved sanitarian programs, which are offered once a year. And so one of our sanitarians who came on board 2 weeks after that program started. So she can't get the full training until next year.
She was also a sanitarian in another state who was primarily doing food, but there's no reciprocity in the state of West Virginia, and she missed the food training. So the one thing she has the most experience in, she can't do for a full year, which is very sad and unfortunate.
So part of my plan, and I like conflict avoidance, but I think this is past the talking point, is that something has to change, that because we need sanitarians here. It's unlike other counties that are losing population. that can spend time just doing food service. We've got a huge need for building new lots with septic. And
We're also
some counties have
accepting
none
new
of that.
establishments
Excuse me?
too. There's new businesses that are coming into the county. A lot of new food establishments, a lot of short-term rentals, think your Airbnbs, your cabins. These are all permitted through the local health department. I think last year we did maybe 50 total plan reviews, maybe more than that. And right now I think I have maybe 20 that are waiting to be reviewed that have come in the last 3 months. So we're seeing growth on both sides. To put it simply, the volume that the county is requesting of us, we don't have the capacity to meet at this time.
And that's with, us having, as you talked about earlier, because this is fee for service, essentially we're getting permits that we're largely covering expenses with that, not 100%, but because there are a lot of different things going to it, a lot of other things we'd like to do, but we can't, we're not matching competitive salaries yet, but we can't even hire people to do it because we can't get them trained in an efficient manner. And that's a problem with the state. That to me, education is, so they're content experts, but then there's other aspects of education, how do you do it? And it's inadequate. It's been inadequate.
Is there any reciprocity with Virginia or Maryland where they could do any of these classes?
Interesting
Surrounding
to
states.
see
I've no
how the
idea.
governor's new sanitarium thing, so there, if you have a national certification, there is some reciprocity that's allowed.
So I had somebody from the FDA, a retired FDA official that wanted to volunteer his time to help us out. So I had him go before the Board of Sanitarians to see if they would license him since he was an FDA inspector for over 30 years. And they denied him and said that he had to go through the West Virginia sanitarian course to even be able to do anything with us, including volunteer time. So the only thing he would be able to do is shadow. Again, this is a very well-trained, knowledgeable expert from the FDA that they denied. So there's essentially no wiggle room for any amount of education or certification. They want you to do the West Virginia training specifically.
Which for septic, because those are my understanding is they're quite variable from state to state on what the septic requirements are. But the food code is a national food code.
Correct.
That there are different versions. We're on which number are we on? And
We are still in the 2013 food code,
and the most current one is
2022.
okay. So anyway, that's a whole separate thing, but the basics are the same. That you need to not have your raw chicken next to the food you're serving, and things like that. You need to wash hands. That's so the food code really should be, to me, should be something that's much more a national policy. Anyway, so that's something that we're going to make some noise, and appreciate other noise.
So can we put also in this report, the bottom line is we need money.
Yeah.
A lot of these problems could be easily solved if we had the funding. And all of these problems come back to the bottom line that we do not have enough funding to
Correct.
make all of this work.
It is very interesting when it comes to the funding, because the state kind of says, well, you're kind of a state agency, but you're not. And so you're more county agency. The county, not knocking the commissioners, but they have other aspects that they have to deal with too, right? So we kind of get put on the back burner when it comes to that in a lot of cases. And unfortunately, we are in a county that is growing. We're one of the few counties in the state that is growing. In 10-year average, we went up 10% in population. The rest of the state went down 7.3. But way imbalance there. We are extremely small, and when we do talk about we need to increase our billing capacity, we need to do this. At the same time, everyone here wears multiple hats. Not only is somebody billing, but they're also, a purchaser, and they're also a front desk staff, and they're also, our front desk staff is running our IT stuff. Right? Like these sorts of things, right? So where most people, most places, most health departments, they at least have enough to cover. We don't have enough to cover. And one main area that we don't have enough to cover in right now, per state issue, environmental health. One area, we're trying to cover down and do all these things. And again, it's not the fact that we need people to, or that funding of, well, you just need to fund everything. We just need support. And that's, I think, the biggest misconception. We need the support to help us through funding. It isn't, we don't want to rely on everybody, but we just need support because we're not in a situation of, as Dr. Reed said, if somebody leaves, we can't hire. Now, that may be like, okay, for most normal businesses, FHH, if somebody leaves, okay, you still got 85 people covered down in respiratory therapy. That's not how that is here. That one person that leaves now there's not just one position open, but about 8 that aren't getting done that now have to fall back onto somebody else. It is very difficult when we talk about a lot of this stuff to get done. It is very difficult because at any time somebody can be pulled from their job to do something else and then have to go to somewhere else. And so that one person that we talk about letting go, now there's 4 or 5 positions that are actually let go.
And there's nobody that's on the chopping block.
No. Hypothetical. My apologies. Hypothetical. In general, that sort of thing.
But
yes.
I think one thing too, and I've urged your predecessor on this, and I hope maybe you'll take me up on this request, and that is, so we've got the funding piece of it, which obviously we all know very well, but then there's also, as we've talked about many times, is the regulatory piece of it. So the fact that an FDA commissioner or retired FDA inspector, not commissioner, FDA inspector can't perform even like food inspections. We have a regulatory problem in this state.
Yes, we do.
And so and I think right now we have a legislature and a governor who are willing to help make these changes, but they're not going to make the changes without some kind of leadership from somewhere. I don't think our state association represents us well or represents our needs because, again, they represent all 55 counties. Us in Berkeley are different than the rest. And so I think, and again, I know you're wearing multiple hats. But I think as we look towards the next legislative session, I think we need to lead in this respect in sort of helping at least advance our own proposed solutions. To me, they're not that difficult. This is not rocket science. No offense to any rocket scientists who might be in the room. This is not rocket science. And so I think let's utilize the opportunity, particularly when our lawmakers come home after session, and literally you can hand them like, this is what we need. This is how we recommend it. There's 49 other states that do it differently and maybe even probably better than us, and say, oh, we need this relief. So if we can't solve the funding problem entirely, but we can solve some of our problems regulatorily. So that's my request to add to your big giant list of things you have to take on as a new administrator. But also, Alexis, I think your knowledge base and understanding of all of this is tremendous. And so if we can harness some of your talents to maybe help lead in this space, I think it would be tremendous, and I think would be a relief, provide some of the relief you guys are looking for.
And I also feel like, after talking with some of my peers in the region, we can get that support for making some changes. Because it's, even though some of the smaller counties, right, they don't have as many people, but they're still, they still have to go deal with the sanitarian issue as far as training and you know, people retire, people leave, people go on, and that's been happening in this region a lot. And so they're feeling the hurt too. And I think we, as a region, can really make some noise and getting them on board with that. And I think they're willing to be on board with it as well. So.
And we hope to become much more aligned with Berkeley Morgan County, because certainly with the sanitarian workload, that's something we share very much with them.
Yeah, we do currently have a very good relationship with the administration over in Berkeley. And I do talk with them frequently about these issues, and we are very aligned in the needs of both counties.
Yeah, I do think we have the opportunity to do some changes. All right, anything else, Dr. Reedy? We're coming up on our 2-hour mark here. So is there anything else we need to cover in our final 3 minutes?
Good meeting.
Thank you. A lot of hard issues, but I really do want openness of, what are we really facing budget wise or whatever.
I'd just like to make a comment that, well, this is my second meeting. I wasn't here last month because we were having budget deliberations. I thought y'all made a very, very good presentation. I was expecting there to be a up or down vote on your requests, and nothing came, which really surprised me. So it was probably decided before the budget deliberation meeting where it would go. I don't mean that in a nefarious sense, but our new CFO has been very good. Hope you establish a good relationship with David, and Eddie is very, very helpful. And I have the good fortune of being assigned to 4 boards, this being one of them. And I am kind of lucky because all the boards that I've been assigned to are administered and run very well. So I'm pretty happy with my assignments for the year. And my objective is to learn as much as I possibly can about you all and help you navigate through the labyrinth of Jefferson County funding and get you the funds you desperately and deservedly need. So consider me on your team.
Thank you.
Thank you.
All right, thanks everybody. And again, thank you to the staff. You guys are doing tremendous work, and with, again, the strange resources. We all, I think I can speak on behalf of my colleagues that we fully see the work that you're doing and the workload that you guys are taking on. So thank you for that, because you really are doing a tremendous job. So
Thank you.
all right, our next meeting is scheduled for May 9th at 9 o'clock in the morning. And with that said, can I have a motion to adjourn? Or is there a motion to adjourn?
I move we adjourn.
I'll second that as well.
All right, hopefully no discussion as always. All those in favor say aye for adjournment.
Aye.
Aye. The meeting is adjourned.
And stress everybody needs to be here next month for the budget vote.
Yes. I plan to be there in person. I'll be flying back Thursday of that week. All right, thanks everybody. Oh,
So you just all over the place, ain't you?
yep.
Thank you.
All right.
Thank you.
Thank you.
Thanks everyone. Take care.